This symposium is related to cancer prevention. Disease prevention is a problem in most of our countries, mainly because poverty is more important than disease prevention. People are looking for food, not for disease prevention. The governments nowadays are becoming more aware of the need of spending effort and resource in prevention because it will cost less in the future. And the point is that governments work based on pressure. If society don't pressure governments, they are very slow in order to promote changes, unless there are some people involved that are really wise and committed to the prevention in our case. So we are here in a meeting where we have people from academies from different countries. I'd like to hear from the panel the feelings on how about academies can help in their own countries to improve activities on cancer prevention. That means education and any others. Thank you.
Okay. If anybody would like to, not from also only from panel, perhaps from the floor as well, I can start by saying just a few words about the Turkish Academy. We started a cancer study group within the Academy about, I think, 7-8 years ago. And that included not only academicians, not only members of the Academy, but there were experts from outside as well. We have made surveys, we have made an investigation of the facilities of different universities and different areas, different hospitals also within the country to see on a fact-finding mission, and we made a number of publications on those lines. And of course, we made some suggestions to the government. I don't know whether they were taken seriously or not, but we made efforts along those lines. I don't know if anybody would like to respond.
In the National Academy of Medicine of Buenos Aires, we have an Institute of Cancer. The Institute is the center of the consensus about not the prevention, but the treatment of the different neoplasia. For instance, the neoplasia of prostate, we have 20% consensus. The center is the academy, and the consensus is made with a different society, scientific society, different university chairs, and so. And this is very useful. But really, the prevention could be more useful, I think, and it's possible that we can make some plan about it. Thank you.
Anybody else like to respond to that? Sure. Just wait a second. Yes.
Yeah, in Trinidad, I don't think that we have enough academies involved in advising the government. I think there's a national cancer registry where they will record the deaths throughout the year and over time. And the Ministry of Health will use that information to guide how they roll out educational plans. So in Trinidad, as I said before, we have 3 major cancers: prostate, breast, and colorectal cancer. And they will use that information to guide how they will roll out education programs on the radio and the TV. There's also, in fact, they have passed a law in the last couple of years where they also ban smoking in closed public places, so that is also enforced. In terms of breast cancer, there's a national screening program for breast cancer where they go around communities with mobile units, and they actually allow women to take the screen, the pap smear and breast cancer, breast screens. But I don't think in terms of the prostate cancer there's a big movement to have men tested I suppose most time men are resistant to be tested, and I suppose they have to come up with some creative ways in dealing with that.
Thank you. From these discussions, I understand that there is probably more room for the academies in the cancer prevention or cancer problem, and they should be more active in this area. Yes, sir.
Roberto Schwarzman from Brazil. I would like to come back to the point Professor Krieger made. And I think that if we take data from WHO, when you look for the different tumor types per region, what you really can do, for example, if you would recommend colonoscopy for everybody 50 years old or older, you have a lot of logistic problems because you cannot do it in most centers. You cannot operate them when you make a diagnosis of cancer. So it's difficult. And for countries like Brazil and our region, if I would address the point made by Professor Krieger, I think we would, the WHO would recommend initially smoking cessation programs, lifestyle actions for long term, and the single tumor type that would be our duty to face, because we can do a lot in prevention and early detection and treating some cases, is cervical cancer. So we are called Group 2 by WHO. We have 3 groups, yes? One group where we have no medical care whatsoever. We have to do basic strategies. And you have in the other extreme, Group 3, where you have a very sophisticated health system, where you already took over all these challenges in prevention and detection. And we are in the middle. And for countries like ours, we have to first take care of cervical cancer in terms of a single tumor type where we can really do something.
Okay, I tend to agree with Dr. Schwarzman's evaluation. Of course, this is a time when screening for breast cancer, prostate cancer must be re-evaluated in terms of yield and benefits versus benefits ratio. I think it's time to, especially for countries like ours, it's time to perhaps rethink our strategies and spend money on more worthwhile areas. Let's see. Last speaker, I think the gentleman from behind.
Thanks to the panel for 4 very interesting presentations. I am wondering, what I'm about to suggest is somewhat a radical deviation from most of what we've been discussing thus far. Now, we have in Brazil, for example, a country that produces a large amount of tobacco, and obviously that generates enormous income for the country. And we've been striving to decrease the amount of smoking. I wonder if, given what we now know about genetic modifications, if it is possible to identify, or we know already what are the dangerous components of cigarette smoke. Can we produce yes. Is it possible to grow a form of tobacco that may be devoid of nicotine and some of the other dangerous chemicals, for one? And then for 2, it may even be possible to use cigarette smoking as a vehicle to get other interesting things delivered in the future. But this is a possibility that the Academy might take as a big project to see. We already have young people interested in smoking, and rather than dealing with the negative of it, let's see if we can turn it on its head and make it into a positive somewhere in the long run.
To help with non-dangerous cigarettes. Yeah, I think, first of all, it's not a matter of producing or coming up with a non-dangerous product. I mean, it's a worldwide economical and social problem. There are millions of people using tobacco throughout the world. So if you find something which is not dangerous or less dangerous than tobacco, it would be quite a task to produce it in amounts and manufacture it, and I think it's more of a dream that time. Yes, sure.
I think this is a very, very dangerous approach, in my opinion, because this would go against all the experience that was accumulated over decades, looking at what the industry tried to do in the tobacco business. They tried to do exactly this. Whenever the society was succeeding in finding good results in tobacco control strategies, the industry would come with some ideas of this very nice new cigarette with less nicotine. So I think
less nicotine and flavor.
Yes. So I think
cigarettes.
The only thing we should not do is to go in this direction. In my opinion.
Okay. Thank you very much. I think
I agree.
You agree. Thank you. Well, I would like to thank all our speakers who have been marvelous, and we were on time. It's now 3:45. We are ahead of our times, so I don't want to cut 5 minutes of your coffee time. So let's be back at 4:05 in 20 minutes and continue with the next session. Thank you very much.